Hi, and welcome to this video with a focus on the key critical question: how can nutrition and recovery strategies affect performance? In this video, we'll be looking at supplementation. Supplementation consists of the following types of dietary supplements. The syllabus looks at vitamins and minerals, protein, caffeine, and creatine products. As a result of watching this video and completing the activity at the end, you should be able to critically analyse the evidence for and against supplementation for improved performance. Throughout, we'll be making reference to the Australian Institute of Sports Nutrition and Supplementation program, and on the last slide in this video you will see a link to that particular program. Supplementation. Dietary supplement can be described by the following features. It contains nutrients in similar amounts to the recommended dietary intakes and amounts found in food, and in a form that is convenient for sports nutrition. Alternatively, it contains megadoses of a nutrient, specifically for the rapid treatment of a deficiency. It is seen as a means to an end, a response to a nutritional need that arises in sport and helps the athlete achieve peak performance, and is supported by scientific trials. Vitamins. Vitamins and minerals are required for good health. Deficiencies can lead to early fatigue, infections, illness, and slower recovery times. Deficiencies in athletes are usually due to lifestyle factors such as poor eating habits, smoking, and excessive alcohol consumption. Deficiencies can be cheaply addressed by improving an athlete's diet rather than spending money on expensive supplements. The body cannot make vitamins, so they must be taken in. They are organic compounds that are required in small quantities for normal growth and development and metabolism. They act as coenzymes to assist enzymes that catalyze the breakdown of carbohydrates, fats, proteins, and minerals. Vitamins are either fat-soluble, that is vitamins A, D, E, and K, or water-soluble. These vitamins include the B group vitamins and vitamin C. Fat-soluble vitamins are stored in the body and in large doses, and these can be toxic. Excessive amounts of water-soluble vitamins are excreted from the body. Excessive vitamin A and D can build up and lead to muscle and joint pain and headaches. Large doses of vitamins in pregnancies can lead to birth defects and in general can lead to nausea, loss of appetite, fatigue, and skin dryness. Some athletes feel that they require antioxidants because of the stress caused by heavy training. These vitamins are C, E, and beta-carotene. Research has shown that megadoses do not improve performance, and fruits and vegetables are strongly recommended to everyone as ideal sources of antioxidants. Vitamin C is needed for resistance to infection and for stress management. B-complex vitamins are required for energy metabolism and release. Large quantities of vitamins can also interfere with the absorption of other vitamins. Minerals belong to a group of micronutrients that are essential for body functioning. Iron and calcium are the two minerals that are deficient in many athletes and in the general population. Other examples of minerals needed include potassium, sodium, phosphorus, and chlorine. These are important in regulating cellular functions such as muscular contractions, fluid balance, and energy systems. Iron is found in hemoglobin, which assists in the transport of oxygen. Lower levels of iron is characterized by lack of energy and fatigue. Sports anemia can result if heavy training is not supported by gradual, progressive increases and an unbalanced diet. This may occur due to a lower intake of iron in proportion to the body's need, or the body's use of protein for things other than red blood cell production. Red meat, whole grain cereals, and green leafy vegetables are the best sources of iron. Iron can either be heme or non-heme. Heme sources include red meat and liver, and iron from these sources are readily absorbed by the body. Non-heme sources include whole grain cereals and green leafy vegetables. They are not so readily absorbed by the body and require a vitamin C source, such as tomato or orange juice, to be consumed with the meal to increase absorption. Drinking tea prior to eating a non-heme source of iron will decrease the amount of iron absorbed by the body. People most at risk of iron deficiency are endurance athletes as a result of sweat loss, females as a result of menstrual blood loss, vegetarians as a result of a lack of red meat in the diet, and adolescent males as a result of growth spurt. Calcium deficiency impacts on bone density and may cause muscular contraction and heart function. Bone density decreases from the mid-20s, and this contributes to osteoporosis. Adequate calcium intake in adolescence has a positive effect on bone density later in life. Sources of calcium include dairy products, green leafy vegetables, and salmon and sardines. People most at risk of calcium deficiency are females as a result of insufficient intake of dietary products or dairy products, and females whose menstrual cycles have ceased, leading to a loss of calcium from bone tissue. Protein. Amino acid preparations have been used in weight and power sports for some time, based on the false argument that consuming more amino acid will assist in the development of greater muscle bulk. Large quantities of amino acid are not required to build muscle mass. If large quantities are consumed at the expense of carbohydrate, muscle mass may be broken down for use as energy. The recommended dietary intake is 0.8 to 1.2 grams of protein per kilogram of body weight. This amounts to 10 to 15% of the daily energy intake. During heavy resistance training, this may be increased to 1.6 grams per kilo. Excess intake is stored as fat since it cannot be utilized by the body. Research has shown that drinking milk after exercise is one of the best ways to replenish protein stores. Caffeine. Caffeine is a stimulant of the central nervous system. Studies have shown that 3 to 13 milligrams per kilogram of body weight taken 1 hour before exercise improves endurance performance. The benefit to an endurance athlete is due to the stimulation of adrenaline, which mobilizes fatty acids to be used as fuel, thus sparing glycogen stores. Caffeine also masks feelings of fatigue and increases alertness. Caffeine is also a diuretic and affects hydration levels. The International Olympic Committee and WADA set a limit of 300 to 400 milligrams of caffeine as the legal limit. That is 12 micrograms per mils. Creatine products. Creatine is found in fish, meat, poultry, and other foods containing animal muscle. It is not possible to eat enough creatine to experience performance benefits, so it must be taken in supplement form. Creatine phosphate works in the muscle as an important component of exercise metabolism to regenerate ATP and speed up recovery. It is often used in weight training and high-intensity exercise involving short, repetitive bursts of activity, such as team sports and sprinting. Creatine has shown to promote weight gain, and it has no benefit for endurance athletes for this reason. 20 to 30 grams of creatine is the recommended dose, taken in 4 small doses throughout the day. This should be followed for 4 to 7 days, followed by 2 to 3 grams per day as maintenance. It should be taken prior to eating carbohydrate meals, and athletes must take breaks from using the supplement. Now, your job is to research the evidence for and against supplementation for improved performance. As you can see, you'd compare the various nutrition companies' research and evidence against that provided by the AIS. Don't merely get some information regarding each of the supplements, but try and look at each of the pieces of evidence critically against that which has been scientifically shown to work or has not been shown to work by the Australian Institute of Sport, Nutrition and Supplementation program. Thank you for listening to this podcast.